This video provides an overview of physical activity epidemiology. We will talk about definition of epidemiology and some of the key terminology related to epidemiology, what we study in PA epidemiology, and its evolution. First, let's take a look at epidemic. Epidemic is the occurrence in a community or region of cases of an illness, specific health-related behavior, or other health-related events, clearly in excess of normal expectancy. A certain disease prevalence increases suddenly during a period of time. For example, the normal expectancy of flu in a rural county of Utah is between 2K to 4K, but in year 2016, 2019, and 2020 is 8K and 10K. We can claim the flu epidemic in the community in year 2016, 2019, and 2020. Comparing to epidemic, outbreak is limited to a more specific area within a certain time period. Well, what about pandemic? Is an epidemic occurring worldwide or over a very wide area, crossing international boundaries, and usually affecting a large number of people? When COVID started in China in January, the WHO didn't declare it as pandemic because it mainly emerged in 1 or 2 countries. Until March 11, 2020, WHO has declared the novel coronavirus outbreak a global pandemic after COVID was spread in 114 countries. To summarize the scale, an outbreak is limited to a specific area and time. An epidemic is an outbreak over a greater area, and a pandemic is widespread across the globe. What about epidemiology? EP is a Greek word that EP means upon, and demos means people, and logos means study of. Thus, epidemiology is the study of the distribution and determinants of health and diseases, morbidity, injuries, disability, and mortality in populations. This is a basic science of public health, bridging between biomedical, social, and behavioral sciences. Then, let's break them. It studies the prevalence of disease, death, injuries, which is the distribution. What causes the disease or death, so the determinants. It is the science which deals with what falls upon people, so the populations. There are some examples of epidemiology studies. Population means lots of people. It is different from clinical science or exercise science, which mainly treats individual participant. Historically, epidemiology studied infectious disease like HPV, HIV, flu, Ebola, and COVID. But recent decades it also focused on chronic disease like diabetes, cardiovascular disease, and cancer, which we will focus on this semester. It also studies what caused the disease, determinants or risk factors of certain disease that could be pollution, food, genetics, smoking, alcohol consumption. We will also discuss how your occupation could have an impact on your health, like chronic disease prevalence difference on individuals with labor-intensive versus desk job. Built environment is a hot topic on chronic disease, as well as health behaviors, such as physical activity and diet. Those studies explore the environment factors, such as access to park/recreation areas, sidewalk, public transportation, and access to fast food or grocery. Epidemiology research also offers scientific evidence on policy and decision-making for government. U.S. Department of Health and Human Services has this Healthy People 2020 and 2030 goals that they sets data-driven national objectives to improve health and well-being every 10 years. Lots of the objectives are set based on epidemiology data. To summarize, epidemiology focuses on the occurrence of health and disease at the population level. Basic health science research typically studies cells, tissues, or animal models in laboratory settings to understand biological mechanisms and the effects of harmful agents such as bacteria or fungi. Common disciplines include toxicology, immunology, and biochemistry. Clinical practice, in contrast, focuses on diagnosing and treating diseases in individual patients, with disciplines such as pediatrics, dentistry, and oncology. Public health, including epidemiology, examines health at the population or community level, aiming to promote health and prevent both infectious and chronic diseases. For example, researchers in Utah study how air pollution affects respiratory health at the population level. Then, let's take a deeper look of the key characteristics of epidemiology. It includes a population focus, studying distribution and determinants, examining outcomes, quantification, and ultimately, the control of health problems. Distribution involves examining the frequency and pattern of health events. The occurrence of diseases and other health outcomes varies in populations, with some subgroups of the populations more frequently affected than others. You may also hear from the news that COVID-confirmed cases varied dramatically among different states, counties, and ethnicity groups. Determinants are factors or exposures that cause or influence health conditions, where a risk factor is an exposure associated with an adverse health outcome. Outcomes varies from health-related outcomes, such as mortality, morbidity, as well as other behavior-related outcomes, such as physical activity, diet, and sleep. As we mentioned earlier, in epidemiology, it involved many data analysis to know the distribution of a disease at the population level, how the disease associate with health outcomes. All these falls within the quantization concept. For the last characteristics, epidemiology aids in the control of health problems through surveillance, risk factor identification, intervention, evaluation, and implementation, which inform health policy development for health promotion and disease prevention. We will go through all the steps in this class. In summary, epidemiology is the scientific study of the distribution and determinants of health-related events in specified populations, applied to the control of health problems. Okay, now let's shift to the PA epidemiology. Everything is the same. The only difference is the outcome becomes to physical activity. Key looks at factors influencing physical activity levels, how to promote it, and its link to health benefits, using exposure and outcome variables. Jeremy Morris, a UK researcher, is considered a pioneer of modern physical activity epidemiology. In 1949, he conducted the well-known London bus study, comparing bus drivers and conductors. Bus drivers spent most of their time sitting, while conductors were highly active, standing, walking, and climbing stairs throughout their shifts. Morris found that conductors had less than one-third the rate of coronary heart disease, and about half the rate of early mortality compared to drivers. This study provided some of the earliest evidence that physical activity in daily life is strongly linked to better cardiovascular health. Before the 1990s, the research paradigm in physical activity focused mainly on exercise science and improving fitness and performance, often in athlete populations. In this past PA approach, physical activity was viewed as structured exercise training, typically high intensity, and delivered through supervised classes or formal training sessions. A medical model dominated this period, where exercise was prescribed at the individual level for behavior change. The key professionals shaping early physical activity guidelines included exercise physiologists, sports medicine physicians, cardiac rehabilitation specialists, physical educators, and fitness instructors. Since the 1990s, the research paradigm has shifted from exercise performance to physical activity and health outcomes at the population level. Physical activity is no longer limited to structured exercise. It now includes lifestyle, transportation, and occupational activity. Funding priorities, such as from NIH, also shifted towards studies that benefit large populations. The focus expanded to include moderate intensity activity and its health benefits. Interventions moved beyond supervised settings to home and community-based approaches, using a public health model to promote activity at the population level rather than just the individual. This shift also brought in social, ecological, and behavior change theories, such as self-determination theory and social cognitive theory. In addition to exercise scientists and physicians, professionals involved in developing guidelines now include epidemiologists, public health scientists and practitioners, and psychologists. Looking forward, the research paradigm is shifting toward active living, emphasizing health and quality of life across the lifespan. Physical activity research is becoming increasingly transdisciplinary, integrating fields such as psychology, physiology, social sciences, economics, engineering, and computer science. The focus is no longer only on MVPA, but also includes sedentary behavior and light-intensity activity. The range of professionals involved continues to expand. Urban planners design walkable and bike-friendly environments, while architects create buildings that encourage movement, such as skip-stop elevators that promote stair use. Transportation engineers and policymakers also play key roles in shaping environments and policies that support population-level physical activity and health promotion. Then, let's take a look at some common models used in PA epidemiology area. The first and most common model is the epidemiologic triangle, consisting of the host, such as the person, the environment, such as physical or social environment, and the agent, such as physical activity or fitness. This model evolved from the early days of infectious disease epidemiology. In PA epidemiology, these models are used to explore the individual and environment factors on physical activity. However, it has been superseded by more recent models. The web of causation model is a more recent model. It holds that a disease has no single, isolated cause. Hence, a study of physical activity and fitness as risk factors for a disease must consider how they interact with other potential causes of the disease. The strength of the web, namely, its acknowledgement that the causes of disease interact with each other, is also its weakness, because its complexity leads to difficulty regarding understanding the etiology of disease and predicting health outcomes. The wheel is probably the most valid model of epidemiologic inquiry because it views the development of the host as intertwined with the environment, and it recognizes that the host develops from a genetic core that is modifiable to varying degrees by the biological, physical, and social environment to which the host is exposed. The wheel is another model. It is probably the most valid model of epidemiologic inquiry because it views the development of the host as intertwined with the environment, and it recognizes that the host develops from a genetic core that is modifiable to varying degrees by the biological, physical, and social environment to which the host is exposed. Furthermore, exercise scientists Claude Bouchard and Roy Shepard have integrated the traditional epidemiologic models to illustrate how the independent and interactive effects on health of heredity, habits other than physical activity, the physical environment, the social environment, and personal attributes might be conceptualized. Here is a summarization slide for this video. Please take your time to review it.